Hello and welcome to the EduTalk series hosted by Biotone EduPartner School Program, and massage industry experts. With the continued interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise, not only for class discussion, but career success. Today's expert is Adrienne Asta, who began her massage career in 2001. She's an approved NCBTMB educator, and EduTalk presenter, and contributor to industry textbooks, as well as she's certified in neuromuscular therapy and prenatal massage. Adrienne's co-owner of Center for Self-Care in Tucson, Arizona, and as president of the Massage Therapy Foundation. She's chair of Community Service Grants Review Committee and serves on the Development and Marketing Committee. She's past presenter of Massage EduTalks and Massage, I want to say not massage, but EduTalk Diabetes series, whose talks are recorded and posted to the archive library on biotone.com under the EduTalk tab. Let's listen and learn as Adrienne discusses breast cancer research supporting massage therapy. She'll review research benefits for those with or recovering from breast cancer, underscoring massage as an effective complementary treatment for managing fatigue, post-op pain, easing symptoms, and reducing anxiety. She'll share how massage boosts dopamine levels, enhances overall well-being, lowers depression, and has a positive impact for those clients with breast cancer or recovering from breast cancer. And we have a lot to get to. Thank you again for joining us tonight. Adrienne, thank you for presenting another great topic for the EduTalk series. I know you have a lot to cover, so I'm going to exit. I'll see you at the end for chat questions. Thanks so much.
Sounds good. Thank you, Danelle. And I always love coming on to the Biotone EduTalk series. You know, Biotone was an integral part of my my initial massage education, and has always found a place in my heart, especially because of their philanthropy. And here we go. Wanted to say a special thank you to Biotone. Year after year, you choose to support 2 of our community service grants, and this year, those 2, I'm excited for you to choose the 2 that you would like this year. They're really fantastic, and it doesn't go, your generosity doesn't go unnoticed. So I want to do a quick overview of just some key points here. So breast cancer is the most common type of cancer in the US for women, with the exception of skin cancers. So it accounts for about 1 in 3 all new cancers. So that's a pretty alarming statistic, and our lifetime risk of developing breast cancer is about 13%. Massage therapy has been used by over 11% of breast cancer patients as part of their care regime, and we're going to look at some research today that suggests that it really should be something that is encouraged as part of treatments by an educated provider. So with that, I want to talk to the expert part from Danelle. Thank you very much, Danelle, for calling me an expert, and I want to make sure that we're completely transparent here. My expertise comes in from my years of service treating stress and pain mostly, and with making sure that my massages are adaptive to the person on the table. So it is based on these stats that you're seeing. There is no doubt, unfortunately, that one of our clients who we're currently seeing is going to get breast cancer or some type of cancer while we're seeing them. So full disclosure, I am not advanced certified in oncology massage. If this is a clientele that you wish to attract, we are really suggesting that you seek the proper continuing education and the advanced certifications that are available for treating this population. So I wanted to make sure if you're on this webinar today, that you feel empowered and have some way to move forward with clients that you have already been seeing that may receive a diagnosis. From this point, if you really want to become an oncology massage therapist, definitely seek out additional training. And one of the reasons why I would put myself in that expert category is because I know when something is beyond my scope and have a regime of people who can complement the work that I do for us to be able to give that client the top care. And I know you all feel the same way. Otherwise, you would not be on this webinar right now. So that being said, this is not a substitute for advanced training and continuing education. So please seek out the proper training. And you always want to encourage your clients to talk to their physicians and their oncologists about the treatment that they might be undergoing, and then also about any concerns that they might have about receiving massage. Always a good idea to connect your massage therapist or for your client to connect you to the doctor. And we want to make sure that everybody is transparent on what we can and can't do. All right, so let's take a look at massage benefits for cancer patients. So we're looking at 6 main areas of focus: pain relief and reduction of stress, nausea relief, physical, other physical discomforts that happen alongside of pain. There's a mood improvement and reduction of anxiety. And we can look at a lot of these as, when we look at them individually. Certainly massage can help benefit these things. Put them all together and you have a client that really needs the help that you can provide. In a comparative study, both healing touch and oncology massage are associated with clinically significant pain improvement in breast cancer outpatients. So let's take a moment to review that term, clinically significant. So when we're looking at our research and we want to be literate, there are 2 levels of significance that we look at, and that first one is statistical significance. So statistical significance just refers to whether or not the results from the study are unlikely to have occurred by chance. So then the clinical part of that, the clinically significant part of that is what we want to look for, right? Will these results cause a meaningful impact in the treatment room? And there is tons of research out there that suggests that massage therapy can be supportive to someone who is undergoing treatment for breast cancer or is recovering from that. So let's move on, shall we? Okay. As far as depression and mood, it is no surprise that the clinical practice guidelines from the Society for Integrative Oncology recommends massage therapy for depression and mood disorders in breast cancer patients undergoing chemotherapy. So we are really there to hold space for that client. And that is, again, no different than what we are supposed to do in our regular practice for any client. But can you imagine the significance that you can have in somebody's trajectory of their treatment if we really embrace that this is a big non-physical skill that is important to the work that we do. And we take a look at, when we do research, we do them in the pieces, right? We kind of take it apart to examine each piece. So this is what happens to the skin when we glide over it. This is what happens to the fascia when we lift it and shift it. And taking a look at the things that we do that are not necessarily associated with our hands on a client are really important. So here we're looking at a relationship that we have, right? A client-therapist relationship that is so ultra important to the mood and the outlook and patient satisfaction during this time is your loving presence. And it should not be accounted for when we're taking a look at our research. And I was thrilled to see this study out of the cancer journal. So I'm hoping that you're seeing value in the symphony of things that we do, not just that we're putting our hands on people. Manual lymphatic drainage is a type of massage that can help treat breast cancer-related lymphedema. So lymphedema is a specialized technique, and we may have learned some basics in our foundational training. However, it's not only important that we master the skill and the practice of manual lymph drainage, but that we understand how the lymphatic system works, because this is a one-way system where the client, if they experience congestion in that in a certain area, it can become quite painful. And we want to make sure that we're not doing anything that's going to exacerbate that. So having an idea about manual lymph drainage and how the lymphatic system works is crucial. So when we're talking about breast cancer patients, the most likely we're going to see congestion on the side where there is any kind of lymph node removal. Then it's just important to know that you want to work from a proximal area before you work distal in the event that that's happening. And if you don't feel confident in your skills, it's best to avoid the area. Of course, understanding how the lymphatic system works, you want to be careful and mindful of what parts of the body drain into which duct, the right lymphatic duct or the thoracic duct, and it is key that we assess the health of the client's tissues and make sure we're not contributing to any problem here. So someone who is knowledgeable in how the lymphatic system works, and some basic techniques of manual lymph drainage and some advanced techniques in manual lymph drainage as well, we'll see positive results from the lymphedema that can be caused by removal of lymph nodes in the area. We all know sleep is a problem that is commonly experienced from a cancer patient. And the good news is we could be really helpful in this area. In a meta-analysis of randomized control trials of CAM techniques, so that's complementary and alternative medicine techniques for cancer-related insomnia, massage therapy was shown to be the most effective in improving sleep quality. If there's anything that you can hang your hat on, it's help in this area. If we're able to sleep and get quality sleep, we are putting ourselves in a better spot and having a better chance of healing processes and recovery happening. And we all know how we feel on a good day when we don't get enough sleep. Imagine somebody who has this, cacophony of symptoms going on top of it. Can be really disheartening and distressing. All right. Another benefit is reduction of nausea. So in numerous studies, massage has been shown to help with chemotherapy-induced nausea in breast cancer patients. So, again, if we're nauseous, we're probably not eating. If we're not eating, we're not fueling our body with the building blocks of healthy tissue. So, massage therapy helps to reduce nausea. There's one thing I wanted to bring to your attention on this slide, that I did this on purpose so that we can do an activity together to see what we can do with the resources that we have through the Massage Therapy Foundation. So I'm going to just highlight for you there. I'm not sure if y'all see on the bottom footnote, this particular reporting is from the Journal of Alternative and Complementary Medicine in 2007. And I said, this is great. I love this for the nausea slide. And then I realized that it's 17 years since 2007. I don't know how that happened, but that is the case. And let's see if we can find some information that supports this study that's a little bit more recent. So I would like to just go through a process that I particularly do. If I come across something that, hey, I resonate with that. Well, of course, massage therapy will help reduce chemo-induced nausea. That makes perfect sense. And then, making sure I'm, not in a confirmation bias mode. I want to take a look at the resource. Okay, well, that's dated according to our research standards. We want something to be a little bit more recent. So I'm going to stop sharing this screen real quick, and I'm going to pop on over to the International Journal of Therapeutic Massage and Bodywork. Okay, so I started the process for us because I wasn't sure how much time we were going to have. And now I realize I'm going super fast. So here's the chemotherapy. I put these two keywords in the search bar, and you would be able to just click on search right there, or there's a little search bar there. IJTMB.org. So I just want to see chemotherapy and nausea and see what comes up. And search there. Okay. All right, so we have a couple of things. The value of qualitative research in massage therapy. Okay, here's something. Experiences of touch therapies in symptom management of rural and regional cancer patients in Australia. That is specific, and which is great. So we are going to click on that. We see that's from 2002. Now we're in a good range. So here we can look at articles and read about the abstract. So let me just back up for a second here. The International Journal of Therapeutic Massage and Bodywork is an online scientific journal that is solely focused on massage therapy. It is open access, so that means that you have access to the entire article, not just the abstract. It's also free for authors to submit. This is not common, although we're seeing this sharing and open access aspect grow. The open access piece means that the author doesn't have to pay, which hasn't been the case in the past. So information being able to be shared freely, and we are PubMed Central indexed. We are peer reviewed, and it's a quarterly journal. I highly recommend, this is the first place I go. I highly recommend the journal being emailed to you. You get 4 emails a year, and the email is solely to inform you that it is a quarterly journal. Here's the quarterly email that you're going to get. Hey, the journal is up for download. So you can download it, or you can just read it online. IJTMB.org, and you just enter your email and you're ready to go. Probably the #1 tool in my toolbox for helping to give my clients the best care. And I'm hoping that this demonstration will help you see why. We want to thank our friends at the of the Registered Massage Therapist of British Columbia, who also helps to fund the International Journal of Therapeutic Massage and Bodywork. All right, so this is telling you a little bit about what they were looking for, that the aims of the paper are to identify opportunities to get these complementary practices over to areas where people might not otherwise have access, and showing that the findings show a significant reduction of pain and reduction of fatigue, and there's lots of relevance in other aspects as well. All right, so I like to look at the conclusion first, kind of give me the punchline before I get invested. Given the increased and continued use of touch therapies by individuals with cancer, cancer centers should consider establishing touch therapy services or provide referrals to touch therapy services that can assist with symptom management and improved quality care. By more clearly understanding the benefits of different types of integrative oncology interventions, patients with cancer receive more tailored and effective interventions throughout their cancer journey. This is really promising for us. And to be able to share this exact article with your clients, oncologists, have your clients give it to their care team. Nurse navigators would be really great people to share this information with, because they could really advocate for the patient, and they could advocate for their best care based on their symptoms, curated like we do in our treatment rooms. All you need to do is give this article to them or send them the link. Show them that you care, show them that you are this involved in your client's well-being. So if you wanted to look at the whole article, you could either download it as a PDF or you can look at it online. Right, now we see a little bit more, we see all the detail of this particular study. So I'm not gonna go through the entire article, but you can really see all of the detail and look at the numbers and the charts and the statistics, and we could start asking ourselves questions, and we can see, we see these, what we call these subjective pieces in the article, as well as kind of this, we look at this amount of, objective pieces as well. All right. So there's no conflicts of interests. And in the discussion, sorry to scroll quickly, in the discussions, they talk about kind of the further studies that are needed, and kind of the limitations are, and how the limitations are a part of this study, as far as the ability to, here we go, as far as the ability to be able to replicate the study maybe in a different way. So hoping that you can see the value of IJTMB in not only this, but in further studies. All right, so in practice, like all sessions, massage is best serves the client when the treatment is curated to their needs at the moment. So the symptoms that can be present in a client who's coming to you either in treatment or post-treatment, if we listen to their body that day, what is going to be supportive and unsupportive? That's a really great place to start. It validates how they're feeling that day. And it also takes into account some information that they might not tell you if they were stressed about the treatment. So if we create a comfortable spot for them, let them know that we're here for whatever is presenting today, and then refer out if something is out of scope and or you're seeing negative effects from the treatment. And remember, let's not judge if that happens. Okay, that's just information. Okay. Hey, when I did this amount of pressure in this direction, this is the result that happened. And this is what the client reported as I was doing the technique, and you share that note with someone. Massage research for breast cancer clients can help inform your practice. And this is true for not only the kind of physiological things that are happening, but also the opportunity to start up conversations and perhaps get some education to your clients if that's the case, about the benefits of what massage therapy would be able to do. We don't expect expertise off the bat, but it gives our clients really great comfort on the table when they know that you are interested enough to make sure, and you go that extra mile and make sure they feel safe and they feel validated and they feel taken care of. So using the resources that the Massage Therapy Foundation can give you helps bring that level of comfort to your clients, and then it builds your book like with a really informed and really educated mindset, and that is what we're here to help you with. Being informed may change the way you provide your care, and can help your clients feel confident in the work that you're doing during your treatment. When we look at our research resources, IJTMB, like I said earlier, is my first go-to. We have a unique opportunity, I say a unicorn, to really show our communities, both the people that are on our table and maybe a scientific community or a or a medical community, that like we're serious about what we do here. We know that it has positive effects on populations that really need the work that only we can provide. So IJTMB is my first go-to as a practitioner. NIH and PubMed Central are common areas to go to. We have peer-reviewed articles on PubMed, and we just go to the search bar and type massage and we can see what's out there. There's plenty of filters for years of publication, and you can see where there might be some gaps when you do that work. We have an opportunity to fill those gaps. Google Scholar is a really great way to start your search. If you've never done any research before, IJTMB pops up in Google Scholar, so that makes us feel really good. And ResearchGate is yet another research resource for just finding out the latest in breast cancer massage and anything else that you might want to know. So we have some grants available at the Massage Therapy Foundation. We have funds set aside specifically for breast cancer related community service grants. This was funded through the Jack Project. Marshall Denicky raised money in memory of his daughter who passed away from breast cancer, in order to fund projects that are specific for breast cancer, those undergoing breast cancer treatment, or their caregivers. So with the application process for the 2025 year opens later this fall. The Massage Therapy Foundation has resources beyond research as well. You'll see community service resources there. You'll see infographics that you can use for your clients and to talk with your colleagues and your allied care professionals. We have a podcast, Research Perch podcast, which not only explores how you can fit research into the treatment room, but also the other good work that we're doing here at the Massage Therapy Foundation. You can look at a case report hub, and our practice-based research network is something that we'll send more information on with the notes from this particular webinar. So we hope you'll enjoy all of these resources. They're free because of individual donors like you, and because of really great sponsors like Biotone. Biotone, for over 20 years, you've been supporting the Massage Therapy Foundation community service grants. It is bringing massage therapy to areas of the country and the world, to people who could benefit from massage therapy, but they don't have access due to illness, injury, distance to care, socioeconomic status, or some other barrier that prevents them from receiving the good care. So, and they'll never be able to say thank you to you individually. So to me, that's the true spirit of giving. So thank you, Biotone, for donating to the community service grants. Special committee to my heart. And thank you everyone for coming today. I wanted to see if I could take some time right now to answer something in the chat.
Well, I'm back on screen with you, so thank you. You
Started tearing up a little bit with
that.
the Biotone support for community service.
Oh, well, you put a lot of information out there, and that's much appreciated, not only for your presentation tonight, but also the resources that are available to therapists through the Massage Therapy Foundation. And I appreciate that. I know that Adrienne has done a past presentation for the EduTalk series on MassageNet, and that can be found in the EduTalk archive library on biotone.com. It's an excellent way for you to participate with what you're learning from your clients and through your practice and able to share. Are you raising your hand?
Yes, I am. I want to just piggyback off of that because we have time, and I want to show kind of a real life example of how MassageNet works, right? So here we're talking about breast cancer today, right? So one of the goals of MassageNet is to be able to bring people who might otherwise just practice individually, right? Or maybe you don't have the system set up if you work in a location that has multiple practitioners, but maybe you don't have time set aside for, okay, every Monday at 2:30 we're going to get together and talk about our clients and do rounds. Some people do that, and I think that's great. But some people don't have the access to that structure. So MassageNet, one of the many goals of MassageNet is to be able to bring us together. Hey, who's in the 85716 zip code? Like we're gonna get together and we are gonna talk about breast cancer. Bring stories about your clients and like what has been working and what hasn't worked, and some negative effects of your work maybe that have happened. And let's go to IJTMB together and let's see what the latest is. So we really have this subject matter that we can bring to the table and say like, hey, let's just see what we can do here. Let's share best practices. And I I thought that it's like, man, Adrienne, like you just do not have time to do that. And what I remind myself of is I don't have time not to do that, because that is the piece that's going to keep me sharp and informed and on my game, right? It's not just like, I believe in continuing education. I'm a continuing education provider. The foundation is a continuing education provider. We need to continue our education. It is the right and ethical thing to do. And I want more than that, right? I want more than 24 hours in 2 years. I want to know right now. I don't want to know next month. I want to know right now. Let's see what we can do together. And you don't have to do it alone. We have people who are interested in the same thing. And I think it can really make for a flourishing. Yes, it is very similar to a journal club, and that's part of the goal of MassageNet. It's not just being able to participate in research, although that is an awesome thing, right? That is also awesome. Hey, zip code 85716. I'm just using that zip code because that's where my clinic is, right? So, hey, 85716. We're doing a study on massage and breast cancer research and breast cancer, et cetera, et cetera. Who in this zip code would like to participate in this study? You would practice at your own practice, and just have a couple of guidelines that that the primary investigator asks you to look out for. You'll be informed of what you need to report. All you got to do is your thing, right? So I think it just opens up our world to be able to help more people, and that's really what we want, and that's what MassageNet can do. It's free to join right now, so I recommend doing that. It's again, you're not going to get pinged with junk email. It's just going to inform you when there's an opportunity available.
And we just had a comment come in. We do something similar here with our team at OSU. It has been great at sharing or starting conversations and looking at a variety of topics. I would love to do this in Oahu. Another comment. And thank you for joining us from Hawaii.
Yeah,
Um,
aloha.
Adrienne, I thought, and can people contact you or send you an email if they are interested in getting started
Yeah.
on a group like this?
Yeah, so president at massagetherapyfoundation.org is my email, and be happy to help you get started. This
All right.
Yeah, for sure. This would be great.
And I'd like to mention that tomorrow you'll receive a follow-up email with a copy of the recording as well as Adrienne's contact information and a copy of the PowerPoint presentation that you can refer back to. Additionally, there will be a link to participate with MassageNet. And then again, if you do not find it in your in basket by the afternoon, please check your junk or spam folders. I appreciate that. When you were talking about IJTMB, I appreciated that you said it's something that you can share with your clients, let's say health and care team,
Yeah.
the nurses, so that you're having a full conversation around the client and
Yeah.
sharing information. So I thought that was a great suggestion for people to get involved. And the
Yeah,
more they know you, they might refer other patients or clients
for sure.
as well.
And
And
I noticed when I started making reviewing IJTMB a regular part of my practice, so a disciplined moment to do it, that it just naturally starts coming up in conversation, and it builds such an unbelievable trust between you and your client that, it would be difficult to make a bad choice. Right. And I think with something like breast cancer and lymphedema and um, just dealing with a complex case. You don't want to hurt someone, whether it's inadvertently, or, just, you just don't, nobody wants to hurt somebody on purpose on this call. I'm positive, but like, so you don't want to mess up, you don't want to make a mistake. And I feel like the information you get from IJTMB and from just being on top of all of the information just gives you that, it kind of neutralizes the information. It doesn't give it any kind of emotion either way. It's like, this is what can happen. This is what you can look for. Here's some ways to consider making a change. Um, Here is why you should trust this information or not, right? So, it really just, it takes that anxiety off of, what if I hurt somebody? So if you just really, just embrace being informed as an active part of your practice, then for sure, you're going to be successful. And I appreciate Biotone having this series to give us an opportunity to embrace that kind of constant learning mindset. Appreciate you, Danelle, and I appreciate you, Ceci, and Jean. You guys are doing a really great job.
Well, thank you. I wanted to just jump back to the EduTalk archive library, which we started EduTalks in 2020, and we have had different presenters do topics surrounding breast cancer, as well as manual lymphatic drainage, lymphedema. So please, take a few minutes as well to search out the EduTalk archive library on biotone.com and get some other perspectives on how you can help and treat your clients. And with that, Adrienne, anything in closing?
Massagetherapyfoundation.org. Take a look at all the good stuff, and know that it's made possible from your donations, and you're grateful, your very generous sponsorship. Thank you, Danelle.
Well, thank you. And I'd like to mention our upcoming November EduTalks, which November 5th, Ariana Vincent will be presenting the process of becoming a massage therapy instructor and CE provider. On November 12th, for the EduTalk Diabetes series, we have Jennifer Pressimone, who has presented for the EduTalk massage series on aromatherapy. Jennifer will be presenting Navigating the Emotional Journey of Diabetes with Scent. And we close out October right before Thanksgiving, November 26th, with Kelly Lenny, who has also been a previous presenter for EduTalks. And her topic will be expand client sense of well-being through social wellness trends and ancient healing traditions. And you can listen to Jennifer's EduTalks and Kelly's as well in the EduTalk library. Thank you so much, everyone, for all you do for the massage profession and understanding that it's lifelong learning. And with that, thank you, Adrienne. Thank you, the Massage Therapy Foundation. And thank you, everyone, for joining us. Please join us again in November. And check out the Diabetes EduTalk series as well. As some massage therapy presenters have taken up how diabetes fits into massage practices and working with clients with diabetes. So a lot of good information. Thank you again, all. And we'll see you next time. Watch your inbox for invitations. And again, the follow-up email to today's EduTalk. Take care. Be well. Thank you, Adrienne.
Thank you.
Okay. Bye-bye, everyone. Be safe.